This MediSync ECG review will focus on case number 497 from ECG Wave-Maven. Copyright information is provided here. A middle-aged woman with striking ECG findings noted on a chronic basis. No history of congenital heart disease. What would you expect on careful physical exam? The answer, a loud S2 P2 with RV lift. The ECG shows sinus tachycardia consistent with autonomic activation in a patient with classic findings for severe right heart overload. Note the right axis deviation, estimated to be about 120 degrees, in concert with relatively tall R waves in V1 and ST abnormalities in V1 to V3. Consistent with RV overload, the RV strain pattern. The P waves are slightly peaked, consistent with right atrial overload. The patient had a severe acquired pulmonary hypertensive syndrome and restrictive lung disease with RV dilation and dysfunction. A holosystolic murmur might also be heard in this context due to tricuspid valve insufficiency with large CV waves and possibly an inspiratory increase in murmur intensity during spontaneous inspiration. Note that the ECG constellation here, absence a pulmonic stenosis murmur, speaks strongly to RV overload and pulmonary artery hypertension, but does not by itself indicate which of the multiple causes of pulmonary artery hypertension are responsible. For that assessment, clinical further information is needed.